An estimated 500 million people infected, between 50 and 100 million dead. A world torn apart by war and by a strange, deadly new disease. It swept across the world, leaving nowhere untouched. It was so deadly, rumors spread through the streets that the Black Death had returned. This was the Spanish flu of 1918, the deadliest pandemic of the 20th century. Epidemics have infected societies throughout history. Usually epidemics come and go, but some truly stand out for their viciousness. In recent history, there has been no pandemic more devastating than the flu of 1918, sometimes called the Spanish flu or swine flu. It killed about 675,000 in the United States alone. The outbreak came in the midst of World War I, and the flu would actually kill more troops than combat. The flu of 1918 was so deadly it killed more Americans than World War I, World War II, Vietnam, Korea, and the wars in Iraq and Afghanistan combined. Yet Spanish flu was horrifying for even more reasons. It was very contagious, and it killed extremely quickly, sometimes in as few as 12 hours. It killed people in the prime of their lives, with the most victims being young, healthy people aged 20 to 40. Additionally, it killed some of its victims in bizarre, brutal ways, completely unlike a typical flu virus. The flu comes in waves. That's why we have a flu season. Although it may seem like a bad flu is done, the flu can hide for a while, or go infect people in a different part of the world, and then return even worse. In the case of the 1918 flu, 3 waves of flu devastated the world. The first wave wasn't too bad, but the second and third waves were extremely dangerous. The outbreak at Camp Funston came just at the end of the flu season in the United States, so the first wave infected a lot of people, but then faded away. The military wasn't worried. They were grappling with a far more deadly outbreak of measles at the time. The flu virus seemed to fade away, but really it just went abroad to take on a world at war. It stalked into camp when the day was damp and chilly and cold, with a hand that was clammy and bony and bold, and its breath was icy and moldy and dank, and it killed so speedy and gloatingly greedy that it took away men from each company rank. The flu, Private Josh Lee, 1919. And Philadelphia was ready to hold the Liberty Loan Parade to sell war bonds. Public health doctors begged the city to cancel the parade, terrified that it would cause the outbreak to become an epidemic. The city government ignored them. On September 28th, hundreds of thousands of people jammed into the downtown streets to watch the parade. In that huddled crowd, all crushed together, it only took a few coughing, sneezing people to launch the epidemic. Within 76 hours, just 3 days later, the city's 31 hospitals had run out of bed space. They were completely full. Some hospitals tried to cram in more by laying patients on cots in the hallways, in offices, and on balconies. In some cases, the sick were laid on the floor next to a dying patient. Once the patient died, the body was taken away, and the new patient would be lifted into the same bed, still warm from the previous occupant. The city opened several temporary emergency hospitals, but it wasn't enough. Hospitals started refusing to accept any more patients. People lined up outside begging to be let in. Some died standing in line. Even for those who got in, care was non-existent for most people. The hospitals ran out of medicine. The doctors and nurses were overtaxed, and they were dropping from the flu. They were desperate for help. Towns in Colorado set up barricades on the roads, and men guarded them with shotguns, preventing anyone from coming in. Other towns couldn't stop the trains from rolling through on their local platforms, but they refused to let anyone step off the trains. Anyone who did was thrown in prison and quarantined. It didn't work. The virus still slipped in. The only place that escaped the worst of the wrath was San Francisco, and historians credit that to aggressive response by the local government, who listened to their public health officials. Public Health Director William Hassler quarantined all naval stations before they had any reported cases. He knew it was only a matter of time. He ordered all public schools and gathering places closed. He divided the cities into separate districts with distinct support staff so as to segregate outbreaks. He laid out plans and organized the flu response before the flu ever hit the city so they would be ready when it did. The city's government, medical, and civic organizations banded together to educate citizens on prevention such as hand washing, avoiding public places, and wearing a face mask. While Philadelphia's government was still denying there was a problem, San Francisco authorities were distributing 100,000 face masks. Police enforced the face mask rule at gunpoint and actually shot people who refused to wear masks in the streets. As the second wave diminished throughout the country, San Francisco rejoiced for having missed the flu. The flu would mutate once more and rage through the world for a third time, but infecting and killing fewer people. This time it would be less severe. This time it did hit San Francisco because they thought the flu was already over. The third wave hit the Southwest and Midwest hard, but for the rest of America, the worst of the flu had passed. In India alone, it killed about 20 million people. You may be asking yourself, could a deadly flu like that happen again? It's important to understand that the Spanish flu was devastating for a number of reasons unique to that time. However, the essential formula for epidemics still exists. Viruses sometimes jump species, for instance from pigs to human. This could happen at any time, anywhere in the world. And of course, flu viruses are constantly mutating.
My name is Edna Register Boone. I was born in 1907 in rural Houston County, Alabama. We moved away from the farm when I was 3 years old and moved into the little town of Madrid, still Houston County. Times were troubled, a war going on, the flu epidemic that followed the boll weevil, 3 catastrophes right there. A new disease, just like another epidemic would be, perhaps, maybe not the flu, but something else. And it would be a new disease. We would have to learn to deal with it. I was 10 years old, and my family was the only family in the little town that did not contact the flu. Therefore, my parents became automatic nurses. They nursed every family in town, and one family in particular was outside of town limits. My father and Uncle Eli, whom we called his manservant, dug a common grave and buried 3 people in it: mother, father, and a young daughter. Unfortunately, we had no sanitary conditions in the area at that time, so the people were buried in the clothes they died in and wrapped in the sheets because there was no way no one to wash the bed linens for them. So they were buried in a common grave. I do not remember a single church burial caused by the Asian flu. It was prevalent. The greatest problem, of course, was getting medication. Only had one doctor, Dr. Andres, a wonderful man. He did the best he could. We had no penicillin, no sulfur, nothing to treat that dreadful disease. Of course, there was wagon loads of sick people lined up at his front door all the time. If you loaded a sick person whom you could no longer help and put them in a wagon, which is what most transportation was, put them in that vehicle and take them to Dothan, to a hospital, that chances are that patient would be dead when they got there. Okay, if it wasn't, there would be no room. The rooms would be filled. the doctors would be worked to capacity. That's why most families just buried their own dead. The flu itself, the so-called, I think they called it the Asian flu, affected the throat and the windpipe and chest. And lack of medication. We had a little drugstore, and he had a pharmacist, a hired pharmacist, but he could only supply Paragard or maybe mentholatum, or I don't know what kind of ointments they put on their chests, but that's about all there was. And my mother's would take a half a teaspoonful of soda and put it in a glass of water for each of us, my twin brothers, and for me, and we would drink that before breakfast. I've often thought that that's what saved us. She said that soda would neutralize the system, and we would be less subject to pick up the germ. It must have worked, because we were the only family entire family that escaped having that dreadful flu. It was my job as a 10-year-old to take food to people, to families that were all of them stricken. Mama would put a gauze bandage around my face, and she kept sterilized fruit jars on the stove at all times, and she would fill those jars with soup or whatever there was, and I would take those jars to the home of an afflicted family, knock on the door, and leave the food at the door for someone to come pick it up. It was not a pretty picture. It was my job to see that the old-fashioned ranges that we cooked with had a reservoir, a hot water reservoir attached to the side of the stove. It was my job to see that reservoir was full all the time. And of course I had to haul water up out of a well, but that wasn't hard for a 10-year-old. But anyway, it was my job, my twin brother's job, to see that there was plenty of wood cooked for the fireplaces and the stove. One thing I remember that my father did, there was an open space on one side of our house, I would say the west side of that Papa plowed up totally. I don't know what the measurement was, but I'd say 1/4 of an acre, and planted sweet potatoes. And I would say that half of the community lived off that potato patch, because no one was able to go shopping. No one was able to cook. They could bake a few potatoes even if it was in the fireplace. I knew I had to participate. I knew that my family was being protected. I was raised in a Christian family, and we had our evening prayers. I knew I had to do my part. I came home one day, I don't know where I had been, but I came home and Mama was stretched out on a pallet in front of the fireplace. Oh, I panicked. Mama, Mama, are you sick? She said, no, child, I'm just so tired. I wanted to get as close to the fire as I could. She said, I knew if I got into that bed that I might not ever get up. We were like a great big family, you might say. I doubt if we had 200 residents. It brought families closer together. And it brought our little town closer together because we all suffered losses. One way or the other, if not through war, then through the epidemic. Oh my goodness, what if it happened suddenly, say within 3 or 4 days, or some sort of epidemic sweep through? I think the only thing I could suggest about that is to be aware that it could happen again. Children need to learn about what could happen. Of course, I'm sure hospitals are aware. But the shock wave that sets in when something like this happens kind of stuns people, you know. They go beyond thinking correctly. And lots of times I would come in and I would cry because of all the sickness that was around me. And I knew that that sickness was deadly. It was depressing to me. Be aware. Be aware.